We're taking a look at mental health because for the first time, a major study of thousands of Australians has mapped the diversity of attitudes towards the issue of mental health. It reveals a clear majority of Australians believe the nation is facing a mental health crisis and wants some sort of action. The study is called the Mental Health Compass. It's been released by Australians for Mental Health. Chris Gambian is that organisation's Executive Director. Hello, Chris.
G'day, Peter. How are you?
Good, thank you. This is not any old study, Chris. It's been called the most in-depth social investigation into public attitudes towards mental health and well-being ever in this country.
Yeah.
How so? What makes it so big and large?
Well, I think what we've done here is a bit different to what most of the research about mental health is. Oftentimes we're researching the prevalence of mental health issues. That is, how many people have got mental health conditions, and people's experiences with those. But we've done something a bit different here, which is to try to understand people's attitudes towards mental health as an issue. Because if you think that one of the things we're trying to do is create change so that fewer people are experiencing mental health challenges, and those people who do experience them have much less severe symptoms. So how do you do that? Well, we've got to start changing behaviours, we've got to change public policy, and that begins with understanding where people are at with this in the first place. So what we've discovered is there are some people who are absolutely on board. Mental health is a big issue, they say. It's an urgent issue. They're willing to get involved. They're willing to do things. But on the flip side, they don't necessarily fully understand some of the weaknesses in our system. We've got other folks who are just doing it really tough. They've had a lot of mental health challenges. They keep butting up against systems that don't work. They've lost faith in some of our institutions. We've all the way through to one of our groups that says, you know what, all of this talk of mental health, it's a bit overblown. People are carrying on a bit. They need to get over it and just start looking after themselves. So until we understand that, we're not going to be able to actually really drive change.
We're never going to be all completely on the same page, were we?
Australia is far too big a country for one size fits all, and hopefully this is going some way towards seeing those differences.
What is the most important finding from the report for you, Chris?
It is that most people, overwhelmingly, people recognise that mental health is not just a medical condition, it's not just an individual condition, but it is actually a big, broad social collective issue that we've got a collective responsibility to do something about. So it's not just about you being sick, getting a diagnosis, getting a tablet or getting some therapy. It's about saying in every part of our lives, there are things that can help our mental health and there are things that can hurt our mental health. We've got to get on top of those.
You said we're a big country. We're a diverse country, aren't we? Is that what's driving the different views? We come from all over the place.
Well, you're in Albany, I'm in Sydney. This is one of the largest countries on earth. We've got so much difference between us. But most importantly, we've got different stories. What you've experienced in your life, where you've come from, where you were born, the family that you grew up in, your economic circumstances, your education, your work, your current life situation, the relationships around you, they're all different for all of us. And that's going to directly influence how you feel about mental health as an issue and even how you experience your own mental health. And that's something that I think it's really valuable we're starting to get on top of.
You can talk to me about your mental health journey, 0448 922 604 on text, or your attitude towards it, and what has driven that view? What has guided you to where you are? 1300 560 222. I'm speaking with Chris Gambian, the Australians for Mental Health Executive Director, about the Mental Health Compass, this study. Trolley's on text. I'll read you a couple of texts, Chris, if that's okay, and maybe get you to say a word or two about them, if that's okay.
Of course.
Trolley's just bringing it right back to basics. He doesn't think people talk to each other enough now, face to face, and ask each other, how you going? What's up?
Absolutely. Number one issue. Across all types of mental health conditions, if you've got good connection in your life, that is not just people around you, because you can be very isolated and very lonely even with a lot of people around, but if you've got connection, you've got someone you can talk to, you can have chats, people who will listen to you and understand you, then you're going to be better placed. Whether you've got a mental health condition or not, you're going to be better placed across all measures. Really important.
Now, this one stat from the study, Chris, is this 58% say we should work together so every person has what they need to live well. But 42% say it's up to each person to manage their own well-being. Sebastian's on text and gives us his story. He says, yes, it is everybody's job to look after themselves, but often these times people don't realise that their mental health is declining. From personal experience, my mental health was shot. The black dog was barking viciously at the door, and I was proud, others would call it pig-headed, to accept that I was declining and take the help that was being offered nearly every day. Thankfully, I've dealt with the demons years ago and I'm fine now. But Sebastian's point is that we should all be looking out for our friends or loved ones' mental health. So does that concern you, that 42% who say, nah, it's just up to each individual?
Yeah, it really does, for two reasons. One is because they are potentially missing the point for themselves, as Sebastian's rightly said, that if you don't allow yourself to recognise that you might have a mental health condition, then you're probably not going to get treated for it. You're not probably going to do anything about it, and you're going to experience it far worse than you need to. But there's another problem, and this is where it becomes a bit of a collective issue. If you've got that attitude, there's a pretty good chance that you're probably playing a role in stopping somebody else acknowledging their mental health issue or getting treatment for their mental health issue. You know, we talk a lot about stigma, but let's really unpack what that means. It means that there are social norms and attitudes around you that are stopping you from getting the care that you need. And that's a pretty big problem, particularly when you're talking about families where it might be young people, it might be, siblings who don't feel like it's okay for them to have a mental health condition. Now, imagine if we applied that kind of logic to a physical health condition. Imagine if some of us went around saying, all this talk about glasses and eye care, it's all a bit overblown. What you just need to do is focus better, and then you'll be able to see. It's idiotic, isn't it? We'd never say that.
No, we wouldn't.
But we do it all the time on mental health.
Yeah, have done for a long time too, sadly, that stigma. But hopefully studies like this maybe will point people towards a better understanding of where they're at and where others are at and how we can open up and talk to each other. On that, though, and we'll wrap it up with this, Chris, if we can, because we do need to move on. But there's a really interesting aspect to this study about loneliness. Can you talk to us a little bit about that?
Yeah, look, 37% of people say that they are experiencing loneliness. They feel like they don't have enough connection in their lives. They're isolated. Our study matches up with a lot of other studies that have consistently shown that in that range between 35 and 40% of us at any given time across all age groups, across rich, poor, male, female, city, country, describe ourselves as being lonely. This is the epidemic in Australia that we're not talking enough about. And it goes to your first text messages point. We lack connection in our community. I think one of the things about technology and living very efficient lives is that we're losing something, and that is our connection to other people. So recognising that and being intentional about connecting with other people, whether it's the barista at your local coffee shop or somebody in the street or a family member or a colleague, just remember that there are people around you. If you're talking to 3 people, there's a pretty good statistical chance that one of them is experiencing loneliness, and it's often not the person you might think.
Yeah. All right. Australians for Mental Health is a national member-based advocacy organisation that has put together this study, the Mental Health Compass. I urge you to go and have a read of it. It's more extensive than we can get into here, Chris, but thanks for giving us a look at it, at least.
My pleasure.